Hi, do you know that there's a type of cancer that affects women that can be prevented and that can be cured? If you want to find out, stay to the end of this video. Hello everyone, this is Health Tips with Joy. You're welcome to my channel. If this is your first time of being here, you are welcome. Today's topic is on women's health, specifically on cervical cancer. So why are we focusing on women's health? Apart from the fact that my channel is focused on women's health, the World Health Organization is also focusing on women's health. This is the fact that women are the ones that raise the future generation. They are the ones that are given the opportunity or armed or expected to raise the children that they begat. So they are expected to raise their children. And how can they do this if they do not have the skills, the knowledge, and the information that they need to impact good information on those children? That's why women's health is very important, because they need to be healthy and they need to give them the right health guidance so that we can have a better future, a better society, and a better world tomorrow. That is why women's health is very important. The contributing factors to poor women's health include social-cultural factors, physical factors. So the social-cultural factors can be grouped into emotional and physical, emotional health and physical health. Under the emotional health, you have things like rape, you have things like gender inequalities. Then under physical, you can have gender violence or sex-based violence. Then under physical health of the contributing factors, you have maternal health, which could contain pre-eclampsia, eclampsia. You have sexual health, which could contain STI, unwanted pregnancy, and cancer. And then you have general health, which could contain hypertension, obesity, diabetes, arthritis, and osteoporosis, which we'll be talking about later. But today we'll be focusing on cervical cancer. Why cervical cancer? This is so because after breast cancer and skin cancer, cervical cancer is the third leading cause of women's death in developing country and in Africa or in Nigeria. This is why we are focusing on cervical cancer. But do you know that cervical cancer can be cured? Are you aware that cervical cancer can be prevented and it can be cured? This is the reason. The fact that 99% of all cervical cancer cases is caused by a virus called human papilloma virus, HPV. That is why if one can prevent the contact of HPV or vaccinate oneself, one can increase the chance of not coming down with cervical cancer by 99%, which is almost 100. What is the predisposing factor? The predisposing factor is sex. This is so because HPV is gotten through sex. That's why unprotected sex is not good. It is advised to stay away from unprotected sex. And also, vaccination helps. When one is vaccinated, one increases the chance of, even if the person is exposed to HPV, the chances of the person coming down with cervical cancer will be reduced. So what do we need to do? What we need to do is to have a regular HPV pap smear test every 3 years, so as to be able to determine if one is in the high risk, if the one has already have it, and to treat it immediately. Most times the cure is either surgery, chemotherapy, or radiation therapy. But if one is practicing safe sex, then one do not have to even come in contact with it, but one cannot vouch for one's partner. That's why vaccination is very key in preventing the spread of HPV and also the chances of coming down with cervical cancer. So what one needs to do is, one needs, if you're sexually active, you need to be checking your pap smear test every three years. What are the predisposing factors? The predisposing factors are being sexually active at a young age. This is so because if one start having sex at a young age, then the person will have a higher number of sexual partners in total compared to someone who did not start at an early age. Multiple sexual partner can also transfer it from one partner to another. Promiscuous male can transfer it from one female to their other female partner. HIV patients have already HIV positive individual already have immunocompromised system, so their chances of coming down with cervical cancer once HPV they are exposed to HPV is higher compared to someone who is HIV negative. So, what is the key point? The key point in this video is if you are a woman and you are sexually active, go and do your pap smear test if you've not done it, and you should have it in mind that you will always do it every three years. And if you've done it before, you've gotten vaccine, you still need to keep repeating it every 3 years if you are still sexually active. And for male, you can also vaccinate yourself to protect your female sexual partners. It's not only females that can be vaccinated, males can also be vaccinated against the HPV virus, but females are more predisposed to the cervical cancer. So, thank you and have a nice day. See you next time. Our next topic will also be on women's health, focusing on menstrual pain. Stay tuned and bye for now. Have a lovely weekend.